I'm Dr. Jason Bowlds. I'm a general surgeon, and every week I try to bring you videos discussing diseases that affect the abdomen. This week's topic is on colon cancer. Every year in the United States, 150,000 people are diagnosed with colon and rectal cancer. Approximately 50,000 people a year die in the United States secondary to colon cancer. Colon cancer is the third leading cause of cancer deaths in the world, and in the United States, it is the second leading cause of cancer deaths in men. Over the past 30 years, we have made strides in the treatment of colon cancer, decreasing your chances of dying if you are diagnosed with colon cancer. But in that same amount of time, the number of actual cases diagnosed every year seems to be going up. One discouraging fact is that Black Americans diagnosed with colon cancer have a 20% increased chance of dying than their white counterparts. We think this is secondary to delay in diagnosis and the fact that they have advanced disease once diagnosed. First, we will talk about the risk factors for developing colon cancer. Obviously, there is a genetic component, and you may be at higher risk and may need earlier screening if you have family members with a history of colon cancer or colon polyps. But actual genetic syndromes such as Lynch syndrome and familial polyposis account for less than 5% of the total colon cancers diagnosed every year. Other diseases such as inflammatory bowel disease, including Crohn's disease and ulcerative colitis, may also increase your risk of colon cancer. The biggest risk, however, for colon cancer seems to be in the Western diet. Any diet that is high in red meat intake, especially red meat that is processed or charred through the process of frying or barbecuing, seems to have a direct link towards the increased risk of colon cancer. We also know that smoking also increases your risk of colon cancer, and any moderate to heavy use of alcohol also has a direct link towards increasing your risk for colon cancer. Next, we will talk about the symptoms of colon cancer. Symptoms from colon cancer usually occur when the cancer obstructs the lumen of the colon, causing obstruction and symptoms of bloating and cramping. It can also cause rectal bleeding by bleeding coming from the tumor itself. Unfortunately, by the time most cancers become symptomatic, they are usually in advanced stages and are difficult to treat. Therefore, early screening for colon cancer before colon cancer becomes symptomatic is the most important tool of finding cancers in their earlier stages, bettering a patient's chances of being cured. I do have another video which goes in depth in discussing colon cancer screening, including fecal occult blood tests, Cologuard, and the gold standard colonoscopy. Just know that colonoscopies should be started at age 50, and for low-risk people, probably need to be performed every 10 years. If you have any of the risk factors that we discussed before, you will likely need a colonoscopy earlier than the age of 50, and more like every 3 to 5 years. Also know that Black Americans are supposed to start their colonoscopy screenings at the age of 45. The American Cancer Society has lowered the screening age for colonoscopies to age 45 for all adults. But check with your insurance company to make sure they follow suit with this recommendation before getting your colonoscopy done. If someone is diagnosed with colon cancer, their doctor may recommend further testing to rule out spread of the disease or in order to stage the disease. Usually this is done with blood tests, including liver function tests or tumor markers. They may also recommend a CT scan and in some cases, a PET scan. Surgery is the only curative modality for localized colon cancer. During surgery for colon cancer, the surgeon will likely need to remove 1/4 to 1/3 of your colon, and with this, they will remove the local blood vessels and lymph nodes that supply this area. The final staging of colon cancer cannot be performed until the specimen and these lymph nodes are sent to a pathologist. The chances of ending up with a colostomy bag after colon cancer surgery are low, but these chances are increased in emergency surgeries and in cases of low rectal cancer. Next, I'm going to try to simplify the staging of colon cancer. Stage 1 basically means that the cancer is limited to the organ where it started, in this case, the colon. In cases of stage 1 colon cancer, surgery to remove the cancer in its lymph nodes can be curative. In stage 2 and 3 colon cancers, this usually means that the colon cancer is locally advanced or has spread to the lymph nodes surrounding the colon. In cases of stage 2 and 3 colon cancer, once you are healed from your surgery, you will likely be referred to a medical oncologist for chemotherapy. Just know that radiation therapy for colon cancer is not usually prescribed. Stage 4 colon cancer usually means that there is distant spread to organs such as the brain, the liver, or the lungs. In cases of stage 4 colon cancer, the mainstay of therapy is usually chemotherapy. In this circumstance, surgery is usually not curative for colon cancer, but it may be recommended that you have surgery, given that left alone, the tumor may eventually obstruct or cause bleeding. Once a patient has completed their definitive therapy for colon cancer, they will likely be followed by their surgeon or medical oncologist with blood work every 3 to 6 months. They may need a CT scan every 6 months to 1 year. And starting at 1 year from their surgery, they will need a surveillance colonoscopy. Usually a colonoscopy will need to be repeated every 3 years after that. My hope is that this brief video has helped to simplify a rather complex topic. If you have found this video informative, please hit the subscribe button below. And in the comments section, please add any topics that you would like to hear more about in the future. As always, I am Dr. Jason Bowlds, bringing you better health through better education.